4 medications that can cause high creatinine levels on a blood test. Every single day, millions of adults get routine blood work. And in those results, one number jumps out more than almost anything else: creatinine. When that number rises, even just a little, it can change everything. But here is the part almost no one talks about. 4 common medications can raise your creatinine level on a blood test even when your kidneys are perfectly healthy. So let me ask you something. Why are so many people doing everything right and still watching their kidney numbers get worse? They cut out salt. They drink more water. They follow every rule. Yet, their creatinine keeps climbing. Their doctor orders another test. And now, they are even more confused. They are avoiding red meat. They are cutting back on coffee. They are eating cleaner than ever. They are trying to sleep better. They are taking their medications exactly as prescribed. And still, every lab slip shows the same thing: high creatinine, higher than before. But here is the twist almost no one expects. For many people, the problem is not their kidneys at all. It is the medication sitting in their bathroom cabinet. A simple antibiotic, a heartburn pill, a cholesterol drug. Medications that can quietly raise creatinine without causing a single drop of kidney damage. Think of your morning routine like a message your body reads. Your kidneys read that message too, and the moment a certain medication enters your system, the lab test can change, even though your kidney function has not. This is not guesswork. It is physiology, and it can confuse even experienced patients. And here is the danger. When creatinine rises for the wrong reason, it can send people into months of unnecessary fear. It can trigger repeat tests, anxiety, and changes in treatment that are not even needed. Worse, it can distract from real kidney issues that do need attention. So today, we are cutting through the confusion. No myths, no fluff, just clear science and real answers about why your creatinine might be high, even when your kidneys are doing their job. And to understand that fully, we need to start with one simple question. What exactly is creatinine? And why does it rise? Let's begin. Before we talk about the medications that can raise creatinine, we need to understand what creatinine actually is. In simple terms, creatinine is a waste product your muscles create every single day. Your kidneys filter it out, send it into your urine, and that is why doctors use it as a quick snapshot of how well your kidneys are working. When the number goes up, it often means your kidneys are having a harder time clearing it. But here's the part many people misunderstand. A higher creatinine level does not always mean your kidneys are damaged. Sometimes, it only means your kidneys are clearing creatinine more slowly for a temporary reason. And other times, it simply means your body is producing more creatinine than usual. Neither situation automatically equals long-term kidney disease. Think of creatinine like traffic on a highway. If the highway slows down, traffic builds up. If more cars enter the road at once, traffic also builds up. But in both cases, the highway itself might be perfectly fine. Creatinine works the same way. It can rise either because your kidneys are filtering more slowly or because your body is making more of it. That is why lab numbers must always be interpreted with context. Hydration matters. Diet matters. Muscle mass matters. And yes, medications matter too. This is where many people get confused. They see a higher number and assume the worst. They panic, change their diet overnight, or stop foods they never needed to avoid. But before making any big changes, it is important to understand what might be pushing that number upward in the first place. And that brings us directly to the next part of our discussion. The many different causes that can raise creatinine, from true kidney problems to temporary, harmless changes that resolve on their own. Let's look at those causes one by one so you know exactly what may be affecting your results. Now that we understand what creatinine is, we can talk about why it rises. And the truth is, there are 2 very different categories. One includes real kidney problems, and the other includes harmless, temporary changes that have nothing to do with long-term kidney disease. Let's start with the causes that truly affect kidney function. Conditions like diabetes and high blood pressure place constant pressure on the tiny blood vessels inside the kidneys. Over time, that pressure makes it harder for the kidneys to filter waste. Autoimmune conditions, such as lupus, can inflame the kidney tissue. Polycystic kidney disease creates fluid-filled cysts that crowd out healthy tissue. And renal artery stenosis, a narrowing of the main blood vessel feeding the kidney, reduces blood flow and forces the kidney to work harder. Certain medications, including some pain relievers and diuretics, can also reduce kidney filtration when used long-term or incorrectly. But then there are causes that raise creatinine even when the kidneys are perfectly healthy. Dehydration alone can make creatinine rise because there is less fluid moving through the kidneys. Eating a high-protein meal increases the amount of creatinine your body produces. People with larger muscle mass naturally produce more creatinine as well. And intense exercise can create a temporary spike simply because the muscles are working harder than usual. Supplements that contain creatine can also push the number up without harming the kidneys at all. This is where many people get confused. They see a high result and assume the cause must be serious. But sometimes, the explanation is much simpler. And to understand that fully, we need to look closely at a group of medications that can raise creatinine even though the kidneys remain healthy. These medications often surprise patients. So let's go through them one by one. Bactrim is a common antibiotic many people take for urinary tract infections, skin infections, or respiratory issues. It is effective, fast-acting, and often prescribed because it clears infections that can otherwise put extra stress on the kidneys. For many seniors, getting rid of an infection quickly is a big health benefit. Here is how it works. Bactrim combines two ingredients, sulfamethoxazole and trimethoprim. Together, they stop bacteria from growing and help your body clear the infection. But trimethoprim also slows down how quickly your kidneys remove creatinine from the bloodstream. That slowdown is harmless, but it makes the creatinine level look higher on a blood test, even though the kidneys are doing their job normally. This is why so many patients see a jump in creatinine after starting Bactrim and worry that their kidneys are declining when they are actually fine. Of course, like any medication, Bactrim does have limits. Some people may experience stomach upset, rash, or sensitivity to sunlight. Anyone who has allergies to sulfa medications should avoid it altogether. And people with advanced kidney disease may need a dose adjustment because the drug stays in their system longer. If your doctor prescribes Bactrim, follow the directions exactly. Take it with a full glass of water and finish the entire course, even if you start feeling better. Staying hydrated helps your kidneys clear the medication and reduces the chance of temporary creatinine fluctuations. Never start or stop Bactrim on your own without medical advice. For people who cannot take Bactrim, doctors may use other antibiotics, such as nitrofurantoin or cefdinir. These alternatives do not usually affect creatinine levels, and they work well for many types of infections. A few extra notes. If you are on blood thinners, diabetes medications, or have a history of kidney problems, always let your doctor know before taking Bactrim. Drug interactions matter, especially as we get older. I am Dr. Mattheus from Kidney Health 365. If you find this information helpful, feel free to like and subscribe so you never miss a new kidney health update. Now that we understand how Bactrim can raise creatinine without harming the kidneys, let's look at another medication that often surprises people even more. Cimetidine, often known by its brand name Tagamet, is a medication many people use to ease heartburn, acid reflux, and indigestion. For seniors who struggle with nighttime reflux or frequent stomach discomfort, it can bring quick and reliable relief. Feeling comfortable after meals or before bed is important for overall well-being, and Tagamet helps many people achieve that. The way cimetidine works is simple but powerful. It blocks the histamine receptors in the stomach that trigger acid production. With less acid being released, you feel fewer burning sensations and less irritation in your throat or chest. But there is an interesting twist. Cimetidine also slows down how much creatinine the kidneys clear from the blood. This does not damage the kidneys. It only changes the test result. Studies show that it can raise creatinine levels by about 15%, even though kidney function is completely normal. Still, there are limits. Some people may experience headaches, fatigue, or mild dizziness. Those with liver disease or older adults taking multiple medications should use Tagamet carefully, as it may interact with certain drugs. Individuals with known kidney issues should discuss dosage adjustments with their doctor before starting it. If you do take cimetidine, follow the instructions exactly as written. It works best when taken before meals or at the first sign of discomfort. Drinking enough water each day can help your body process the medication more smoothly. And if you ever notice a change in your lab results after starting it, let your healthcare provider know. They can help determine whether the change is real or simply a harmless effect of the medication. For those who need alternatives, famotidine is a related heartburn medication that does not raise creatinine levels. Many patients find it just as effective and easier to manage alongside other prescriptions. If you have never used Tagamet before, comment 0 below. And if you have used it at least once, comment 1. I would love to see where everyone is on their kidney health journey. Now, let's move to another medication that can raise creatinine for a very different reason. One that often surprises people even more. Cephalosporin antibiotics, especially the IV forms given in hospitals or urgent care settings, are widely used to treat serious infections. These include skin infections, ear infections, urinary tract infections, and respiratory infections. For many older adults, these medications are lifesavers because they work quickly and help prevent infections from spreading or causing complications that can harm overall health. Cephalosporins work by weakening the cell walls of harmful bacteria, making it easier for your immune system to eliminate the infection. They are effective, well-studied, and generally safe for seniors. But here is the part most people never hear about. Some IV cephalosporins can interfere directly with the lab method used to measure creatinine. This interference does not slow kidney function, and it does not harm the kidneys. Instead, it simply causes the creatinine reading to appear higher than it truly is. The kidneys may be working normally, but the test makes it look like creatinine has jumped. Of course, these medications still have limits. Some people may experience mild stomach upset, diarrhea, or injection site discomfort. Those with a history of penicillin or cephalosporin allergies should use these antibiotics only under close medical supervision. And because these medications are usually given in a medical setting, the dose and timing are controlled by a professional team who can monitor your response. If you are receiving IV cephalosporins, there is not much you need to do on your own. The healthcare staff will administer the correct dose and watch for side effects. What is helpful is letting your doctor know if you have recent or upcoming kidney labs. If your creatinine rises shortly after receiving these antibiotics, your doctor can interpret the result correctly and avoid unnecessary tests or stress. For people who cannot take cephalosporins, there are oral and IV alternatives, like macrolides or fluoroquinolones. Your healthcare provider will choose what is safest for your health needs. And now, let's move to the fourth medication on our list. One that raises creatinine for an entirely different reason and often catches both patients and doctors by surprise. Fenofibrate, commonly known by the brand name Tricor, is a medication many adults use to lower high triglycerides and improve overall cholesterol levels. For seniors who are trying to protect their heart and blood vessels, this medication can play an important role. Lower triglycerides mean less strain on the cardiovascular system and better long-term health. What makes fenofibrate interesting is the way it works inside the body. It activates specific receptors that help your liver break down fatty acids more efficiently. This reduces triglycerides and can even raise HDL, the good cholesterol. But here is the part that often causes confusion. Fenofibrate also increases the amount of creatinine your body naturally produces. Your kidneys may be working perfectly well, but the lab result still shows a higher number. That rise is not a sign of kidney damage. It is simply a normal and harmless effect of how the medication changes fat metabolism. Still, fenofibrate is not for everyone. Some people may experience mild stomach discomfort or muscle aches. Anyone with advanced kidney disease should avoid it unless their doctor gives specific guidance. And because it is processed through both the liver and kidneys, People with liver problems or those taking multiple medications should be monitored closely. If you take fenofibrate, follow your prescription carefully. It is usually taken with food to improve absorption. Staying hydrated and maintaining a balanced diet can help your liver process fats more effectively, supporting the medication's benefits. Never adjust the dose on your own, and always share any unusual symptoms with your healthcare provider. For people who need alternatives, omega-3 supplements or certain statins may be used in place of fenofibrate, depending on their heart and kidney health. Your doctor will decide which option fits your situation best. If you have ever taken fenofibrate, comment 1 below. If you have never tried it, comment 0. Your responses help others learn from real experiences. Now that we have covered all 4 medications that can raise creatinine without harming the kidneys, it is important to understand something just as critical. Not all rises in creatinine are harmless. When creatinine increases because the kidneys are truly struggling, the body often gives early warning signs. Let's take a closer look at the symptoms that may appear when creatinine rises due to real kidney disease. When creatinine goes up because the kidneys are truly struggling, the body often sends warning signals. These signs can be subtle at first, especially in older adults, but they become clearer over time. One of the earliest symptoms is a noticeable change in urination. You may see less urine than usual, or the urine may look unusually foamy, or even slightly bloody. These changes happen because the kidneys are not filtering waste or protein the way they should. Another common sign is swelling in the legs, ankles, or feet. When the kidneys slow down, the body holds on to extra fluid, and that fluid often collects in the lower limbs. Many seniors describe it as tightness in their shoes or swelling that gets worse by the end of the day. Fatigue is also very common. When waste builds up in the bloodstream, the whole body works harder, and you feel more tired than usual. Some people lose their appetite or feel full quickly. Others notice shortness of breath or a persistent itch that does not go away with lotion or soap changes. These symptoms can be confusing because they often overlap with other health conditions. That is why paying attention to patterns matters. If several of these signs appear together, or if they slowly get worse over time, it can be a signal that the kidneys need more support. Understanding these early symptoms is important, but knowing when to take action is even more critical. A high creatinine level should never be ignored, even if you feel fine. Some changes are temporary and harmless, but others require timely medical attention. So let's talk about when a rising creatinine number becomes something you should follow up on, and what steps can help protect your kidney health moving forward. Anytime your creatinine level is higher than normal, it deserves attention. Even though some increases are harmless or temporary, most changes in creatinine reflect a shift in how your kidneys are working. That is why it is so important not to ignore the numbers, especially if you are older or already managing conditions like diabetes or high blood pressure. One key sign that you should follow up with your healthcare provider is a creatinine result that continues to rise on repeat tests. Another red flag is when a higher number appears, along with symptoms like swelling, fatigue, or changes in urination. These patterns suggest that the kidneys may be under more stress than usual. Sometimes the cause is simple dehydration or a new medication. Other times, the kidneys need more careful evaluation. If you recently started a prescription known to affect creatinine, your doctor can help determine whether the rise is real or simply a lab effect. In many cases, staying hydrated or adjusting your medication schedule is all that is needed. But if the cause is not clear, additional testing may be recommended. Early action protects your kidneys and helps prevent long-term damage. The most important thing to remember is this: a high creatinine number does not automatically mean kidney failure, but it does mean you should talk to your doctor, understand the possible reasons, and take steps based on professional guidance. Doing this early makes a real difference. Now that we have covered when to take creatinine changes seriously, let's bring everything together. It is time to review the key lessons from today's video and leave you with a clear, hopeful message about protecting your kidneys every day. We covered a lot today, but the message is simple. A high creatinine level does not always mean your kidneys are failing. Sometimes it is caused by dehydration, diet, or even normal muscle activity. And in many cases, common medications like Bactrim, Tagamet, certain IV antibiotics, and fenofibrate can raise creatinine without harming your kidneys at all. Understanding the difference between a true problem and a harmless change can save you from unnecessary fear and help you make better decisions about your health. But here is why this matters right now. Kidney problems often progress silently. By the time symptoms appear, the damage may already be more advanced. That is why noticing a rising creatinine level and acting early makes such a big difference. Waiting too long or assuming it will fix itself can lead to more serious issues later on. The good news is that small steps go a long way. Staying hydrated, following your prescriptions correctly, paying attention to symptoms, and checking your labs on schedule can help protect your kidneys for years to come. You have more control than you think. And every positive change you make today supports your health tomorrow. If you want a simple next step, start by reviewing any new medications you are taking. Make a list and bring it to your next appointment. And if you have been feeling more tired, swollen, or noticing changes in urination, do not wait. Reach out to your doctor and ask for guidance. Remember, this video is for education only. It is not medical advice and cannot replace a conversation with your healthcare provider. Always talk to a professional before making major changes to your medication or treatment plan. If today's video helped you understand creatinine better, I would love for you to subscribe to Kidney Health 365 and turn on notifications. That way, you will never miss new kidney health tips. And if you want to keep learning, make sure to watch the next video on early warning signs of kidney stress. It might be exactly what you need.